We evaluate these patients to see whether there's any surgery that can be done to them so that they can stop snoring. Yes, so that involves doing something we call sleep endoscopy, whereby we make somebody sleep, of course, under some medications. And once you sleep, we are able to put some small camera through your nose. And as you breathe and as you snore, we are able to see which part of your anatomy or which part of your throat is collapsing. Why I'm saying that is because what would make patient A to snore or what is collapsing in patient A could be different from what is happening in patient B and patient C. So just by listening, you cannot tell which part of the throat is collapsing. And that is why we do the sleep endoscopy. Camera, see where the problem is, because we know there are different places or there are different sites that would constrict or collapse and make that person to snore. And which are these sites? One, it could be what we call the palate. The palate is that flap between the mouth and the nose. And in Kenya, people call it the kirime. So people say, my kirime is very big, and I think that's why I'm snoring. So palate could be one of them, and it's quite common. And in fact, from the patients that I have evaluated, I think it's one of the commonest or the leading sites of blockage. The other site of blockage could be the tonsils in an adult, whereby as you breathe in, the tonsils, maybe they're big, or the tissues around them, their tone is less, so they keep on coming together and blocking the airway. Then, of course, we spoke about the tongue. Sometimes some people have a very big tongue, or not a big tongue, but the tongue is big relative to the jaw. Therefore, when you sleep, especially when you sleep on your back, it falls backwards and causes blockage.